Good day everyone, I'm Marilu B. Arsenio, a caregiver student from St. Augustine School of Nursing, Lipa City, Batangas. Today, I will demonstrate to you the process of doing range of motion exercises on a client. The definition of range of motion is also known as ROM. It is the movement of joints through its full range in all appropriate planes that we can do. It has a different purposes. First, it is the maintenance of current joint functions. Second, restorations of the function. And lastly, it is for strengthening the muscles. The benefits of doing ROM, it is lessen the stiffness of the bones. It will make the person more flexible and it will give a better posture. Reduce risk of injury and it also improve the joint functioning. In ROM, it can be done once or twice a day do counting, where it depends on the capability of the patient. Usually 1 to 3 cycles. 16 counts are equal to 1 cycle. Remember, do not force the full range of motion of the patient if they cannot do it and stop exercises. If the clients feel sharp and in deep pain. Take note, if the patient has respiratory diseases, we need to monitor their blood pressure and respirations. And ROM exercises should not be performed when the joints are swollen or have inflammation. We have different types of range of motion. 1 is the active position, 2 is the passive position, 3 is the active assistant range of motion. Before we process ROM exercises, we need to have a proper position, and draping positioning is a technique of placing the patient safely, comfortable, and effective in preparations for any procedure, while dropping is the manner of arranging the covering to expose body parts of being examined, treated, or cleaned. The purpose of this is to assist the patient to assure positions that will give the best adequate examination or treatment as the body part to provide safety, comfort, and privacy during the examination procedure. Now, let's do the procedure of ROM. First, consult with the physician or client medical diagnostic to determine if doing the ROM is applicable or contraindicated in the patient's conditions. Wash your hand or use alcohol-based hand washing for infection control. Remove your jewelries to prevent transfer of microorganisms. Then identify your patients to make sure that we are carrying out the procedure to the right client. Provide privacy to allay fear and anxiety of the patient by closing the curtains and closing the door. Let's do the process in supine position. Assist the client to lay flat on his back with the legs extended together to afford better muscle relaxation. Place the draping sheet over the client. However, top sheet may use if there is no draping sheet available. Cover the client from the shoulders to provide privacy and facilitate changes of position. Put one pillow under the head and the arm alongside of the body to provide comfort interference during the procedure. Let's move forward to the shoulder part of the client. Do a flexion. Raise the arm forward overhead. And then extension. Return the arm to the side of the body. The vertical abduction. Swinging the shoulder joints away from the body. And the vertical adduction is swinging the shoulder joints toward the body. Take note that there is also hyperextension in the shoulder part. It is extending the arm towards the back. Now, there is also called internal rotation. It is moving the arm downwards, and then the external rotation is moving the shoulder joints upward. Again, let's do it. Flexion, extension, vertical abduction, vertical adduction. Internal rotation, external rotation. Do it also on the other arm. The elbow movement can be conjoined with the shoulders. Do a flexion by grabbing the hand, then the elbow. Bend the arm to the extension by straightening the arm. Flexion, extension, flexion, extension. Now, to the wrist. Do a flexion by grasping the palm with one hand and support the elbow with the other hand. Now, move the wrist forward and to the extension by straightening the wrist. You can also do a hyperextension by extending to the back. Radial deviation is moving forward towards the thumb finger, while ulnar deviation is moving the wrist towards the little finger. Radial deviation, ulnar deviation, radial deviation, ulnar deviation. And the last movement in the wrist is the circumduction, by moving it in a circular movement. Circumduction. Now, remember, flexion, extension, hyperextension, radial deviation, ulnar deviation. There's circumduction. Flexion, extension, hyperextension, radial deviation, ulnar deviation, and circumduction. Now, let's move forward to the thumbs and fingers of the patient. Do a flexion by bending fingers and thumbs on the palm. Flexion the extension to its original position. Abduction is spreading the fingers away from each other. Abduction. And adduction, bring it to close position. And then circumduction. And opposition, touching the end of the thumb in each finger in turn. Flexion, extension, abduction, adduction, circumduction, and then opposition. It also to the other side. Let's move for the hip and knee of the patient. Remove the top linen of the patient. Then, do a flexion by holding the lower extremities in the hip, lifting the leg. Flexion, extension, flexion, extension. Now, the abduction is moving the leg away from the center, and adduction is moving towards the center. Abduction, adduction. Internal rotation and external rotation is moving the lower extremities inwards and outwards. internal rotation, external rotation. Internal rotation, external rotation. Flexion, extension. Abduction, adduction. Internal rotation, external rotation. For the ankle, do the dorsiflexion by tapping up the heel of the patient and moves it upward. And then, plantar flexion by pushing the ankle downwards, pointing to the toes. And the last movement is the circumduction by twisting the ankle in a circular motion. Dorsiflexion, plantar flexion, circumduction. Do it on the other side. After doing the range of motion in the lower extremities, return the top linen to the patient. I will do the spine range of motion because the patient is unconscious. Now, let's start. First is the neck part of the body. Do a flexion position. Your head downward, looking at the toes. Then, extension position. Your head looking straight ahead. And the hyperextension position. Your head looking at the ceiling. Lateral position is moving your head to one shoulder, and lateral rotation is moving your head twisting in a circular motion. Again, let's do it. Flexion, extension, hyperextension, lateral flexion, and lateral rotation. Let's do it. Flexion, extension, hyperextension, lateral flexion, lateral rotation. After doing range of motion exercises, wash your hands and use alcohol-based hand washing. Keep your patient in a comfortable position to provide rest because ROM is a tiring one. Evaluate the other needs of the client and document any unusual circumstances observed. Hope I delivered the procedure clearly. Thank you and God bless everyone.